All right, so I've walked up on what appears to be a man laying on the sidewalk. I've checked the scene. It appears that he's alone. So I'm going to tap him on the shoulder, see if he responds. No response, so consent's now implied. With him being 12 years or older, it's a call for a scenario, so I'm going to call 911 first, then I'll start giving care. First I'm going to check his ABC, so airway, breathing, circulation, and severe bleeding. Airway seems to be clear. I don't see any like severe bleeding or anything, so I'm going to check for breathing. It should take about 5 to 10 seconds. You're like looking for the chest to rise and fall, listening for the air coming out of the airway, and then feeling to see if you can feel the chest rise and fall instead of just seeing it. Now that I've checked the ABCs, he has no pulse, no breathing, no nothing, so I'm going to start CPR with 2 rescue breaths with my breathing barrier. Something like this. For 1 second each. So that way the air doesn't get too far in his system. And now I start CPR, which would be 30 compressions, taking roughly 18 seconds. I'm going to place my hands over top of each other. The heel of my palm is going to be placed right on the sternum, and I'm just going to push about 2 inches into the chest to see if I can't circulate the blood out of the heart. So I'm just going to go. And after that, I get 2 more rescue breaths. And then 30 more compressions. So now that I've done 2 cycles of chest compressions and rescue breaths, traditionally you would do 5 at a time, and if you have another person, you would then switch to prevent fatigue and exhaustion. There are 5 scenarios in which CPR is, I guess, accepted to be concluded or stopped. The victim becomes conscious or aware, a higher trained medical professional arrives, an AED is present, you're physically too exhausted to continue, or the scene becomes unsafe.